Hello, it's John Kanellopoulos from our center here in Athens, Greece, the Laser Vision Ambulatory Surgery Center, Clinical Professor of Ophthalmology at NYU Medical School, New York City, New York. Our favorite subject, keratoconus. The difference here is that we're dealing with a 11-year-old girl. This is the way she presented to us in November. Both eyes were the same. She had a rapid drop in her vision, went on to wear myopic glasses, and since her dad was an AthensProtocol patient of us treated over 15 years ago, he brought her with him from Cyprus, and we were astounded to find out that her keratoconus had progressed so much. We're seeing here a cornea curvature of 54, as you can see here, 50. And this is her today following an AthensProtocol specially designed to be very short in duration. So a 11-year-old girl, even with her mom sitting next to her on the X500 excimer laser, was able to do seamlessly. This is the difference achieved. We were able to improve uncorrected visual acuity from 2060 to 2020 today. It's astounding. We were also very pleased to see that a month later, her ocular surface is impeccable, and it's very hard to note any scarring or irregularity in healing. These were her topography guided numbers with zero refraction set. But instead of doing this and a PTK to remove the epithelium, what we did is we added to this her refractive error. So we did -4, -2 at 14 degrees on the epithelium, and we accounted 2.5 diopters of this refractive error as the epithelial removal for the central part of the cornea. And we added a second card treatment in which we did a +2.5, as you can see here, with a 6mm diameter to complete the epithelial removal. We've reported this as our US technique of doing AthensProtocol, and sure enough, the advantage is that both procedures took 8 seconds for the TCAT and 12 seconds for the hyperopic, a total of 20 seconds of laser treatment. That way, the young lady was able to tolerate the procedure. I think it'd be impossible for her to tolerate the procedure otherwise. And these are her OCT maps today, where we can clearly see the cross-linking line here. So we're at least 50% depth of cross-linking line. We see the epithelium has normalized. It's no more thinner over the thinner part of the cornea. In general, an impeccable result. The youngest patient that I have dealt with, the young girl that I've dealt with, we have done in the past the 18-year-old boy. It is very rare that we see girls at this age with keratoconus. Sure enough, she sleeps face down on her hands and all the other things we've described. So just a alternative technique to our AthensProtocol on a very young patient who was very doubtful that she'd be able to undergo the procedure under just anesthetic drops in the OR of our laser center here in Athens, Greece. Definitely a very pleasant surprise for us to see such an impeccable result, such a drastic improvement in the uncorrected visual acuity. She's 20/20 today, a little bit over a month after the procedure, where the other eye, the better eye, is at the 20/60, 20/70 level, and we're planning on doing that early next year. John Kanellopoulos from Athens, Greece, sharing with you some of the best results we've seen yet. Thank you very much for your attention.